All right. Good evening, everyone. Welcome to the SNMA Sowing Seeds special. Right now, we're hosting the Sowing Seeds series for dermatology, the combined dermatology and plastic and reconstructive surgery talks. My name is Olatunde Balsharon Jr. I'm currently a third year at Wright State University, and I hold the position as in SNMA as the National Plastic and Reconstructive Surgery Liaison, head liaison. Um, and welcome to the start of the specialty series. This is a part of our Sowing Seeds program created by President Asoze Obo in collaboration with the Alumni and Multicultural Affairs National Committee, and and is currently continued with our current national president Nita. Throughout this year-long program, we will provide resources on how to succeed as a pre-med and a medical student, and we'll touch on everything from financial literacy to preparing for board exams and more. So make sure you are a national member by visiting snma.org and signing up today to stay in the know. So without further ado, I'm going to proceed and announce and introduce our esteemed speakers and panelists. Um, so without further ado, I'm going to go ahead and start with our dermatology, the doctors of dermatology. So first, I have Dr. Brian Carroll.
Hi, thanks for having me. I'm Brian Carroll. I'm from University Hospitals of Cleveland and Case Western Reserve University, and glad to be here tonight.
Thank you, Dr. Carroll. Then I have Dr. Uchenna Okoji.
Good evening, everyone. Excited to be here. My name is Uchenna Okoji, and I look forward to speaking with everyone today.
Okay, and we do have one more doctor of dermatology coming. That is Dr. Johnny Woodson Jr., and he will be a few minutes late, but he will be on the way. And as far as our doctors of plastic surgery, I have Dr. Danielle Ward.
Good evening, everyone. Thank you for having me. Excited for tonight's discussion. I'm Dr. Danielle Ward.
Thank you, Dr. Ward. Okay, and then last but not least, we have Dr. Jared Davis.
Hey, good evening. I'd like to thank the panel for having me. I'm an associate professor at University of Mississippi in Jackson and a proud alumni of Meharry Medical College.
Thank you, Dr. Davis. All right, and then also we have one more doctor that will be joining a few minutes late as well as Dr. Salim Mancho from Wright State University. All right, so without further ado, we could get right into it. I guess we can start with you, Dr. Carroll. All right, so for what our audience would like to hear would be just if you could start off with your own personal story and just tell us where you had trained for medical school and how you got to where you are now.
Great. Yeah, so I trained at Case Western with a MD, PhD focus that I initially thought I was going to be an anesthesiologist and couldn't have the other surgeon pick the music in the room. So I looked for another surgical specialty that I could go into, that I could pick my own music. So I picked dermatology, and let's say one of the favorite things about dermatology is that I get to talk with my patients and I get to keep relationships going because they come back. And so you'll see some patients for years on end for multiple revisits for additional cancers that they have.
Amazing. Okay. All right. Then now we will proceed on to ask Dr. Okoji. Would you like to expound on where you trained for medical school and where you are, how you got to where you are now?
Of course. So I went to medical school at Drexel University College of Medicine in Philadelphia. I'm actually a recent graduate. I graduated in 2022, and I matched into dermatology at Montefiore Medical Center, Albert Einstein College of Medicine in the Bronx, New York. Currently doing my PGY1 or intern year at MedStar Baltimore, MedStar Health Baltimore. And so look forward to completing that and starting on in dermatology next June or July. And why I love this specialty, what really got me interested in dermatology is that, it's so versatile in that, you can do so many things with it. You can, there's lots of procedures, there's lots of complex medical dermatology. There is interacting with patients on a daily basis, seeing the impact that you have on their lives. People take their skin, hair, and nails very seriously, and it's great to be able to make an impact on and improve people's quality of life.
Thank you for that, Dr. Okoji. Okay, so now for Dr. Ward, can you expound on where you trained for medical school and how you got to where you are now?
All right, so I attended medical school at Philadelphia College of Osteopathic Medicine's Georgia campus, graduated in 2018. My story to where I'm getting to where I am now is a bit long, but to condense it, graduated in 2018. I was one of the unfortunate ones to not match, but at the time I did scramble into a general surgery traditional rotating internship year, completed that year in general surgery, did not match again, but ended up getting my medical license, practiced in urgent care for a couple of years, was constantly applying to plastic surgery. And then finally, for the 2021 entry, I reapplied through ERAS and was finally successful. And I am currently at Larkin Community Hospital, Palm Springs campus in Miami, Florida. I love it. And then for plastics, I've always wanted plastic surgery. I love the variety. I love the instant gratification of it. I love being the surgeon's surgeon, in a sense of the word, of interacting with all the different subspecialties of surgery. So really makes me happy.
Wow, amazing. Thank you for sharing, Dr. Ward. And Dr. Davis, if you would like to expound on where you trained for medical school and how you got to where you are now.
Yeah, absolutely. As I mentioned, I'm a graduate of Meharry Medical College in Nashville. I graduated back in 2010. When I went to Meharry, I thought I would want to do orthopedics, and I realized through rotations that I had more of an affinity for soft tissue surgery. And as I got more experience in general surgery and plastic surgery, I did gain a mentor during my third year clerkship who is a plastic surgeon. And what I enjoyed the most about that mentorship was the mentor in plastic surgery that I had took time to teach me not only about technique in plastic surgery, but also talked to me about his experience in medical school, residency, and beyond. And that really got me thinking about, where I wanted to be and what I wanted to do 20 to 30 years after graduation, not just what I wanted the 5 years after medical school graduation to be like, but where I wanted to be 20 to 30 years in the future. And, to date, I love plastic surgery because it's a very dynamic field. Innovation has historically been a part of plastic surgery. We operate on patients from, children to adults and across many different organ systems. And so the diversity of the specialty really drew me in.
Amazing, amazing. Thank you, Dr. Davis. Okay, so for our next question, which Dr. Davis, you touched on a little bit. So I'll go back up to you, Dr. Carroll. I just wanted to see if you could expound more on during your ascent to dermatology. Can you speak to any mentors that you did, if you did, and mentors that were in the field or if they were out the field? If you could just expound on that a little bit.
Yeah, I've been fortunate to have mentors at every stage. So in med school, I met the chair of dermatology here at Case Western, and my road back to Case Western is a little bit circuitous. I went and trained in Texas, and then my first practice was EVMS, Eastern Virginia Medical School, down in Norfolk, and then I was at the University of Pittsburgh. And throughout that journey, I maintained a relationship with my current chair, and that commitment to that relationship is why I came back, because he had been supporting me this entire time. And when he called and said there was an opening, it took me about 2 hours to write a 5-page letter of intent, and I was interviewing 4 days later there. So relationships are very important. I also have to point out my fellowship director, Algin Garrett, who had been selected to be chair at a young age and became a Mohs surgeon, which is what I do, and he became a fellowship director. And Algin Garrett down in Richmond, Virginia, demonstrated ethics and integrity in every day of his practice, and being able to work with him shoulder to shoulder. I emulate to be half the surgeon, half the man he is, and the teacher. I still, every time I have a resident challenge me with a creative way of interpreting my instructions, I think of what Algin would do to make the most teaching moment of that, and also to deliver the most excellent care for our patients.
Thank you for that. Thank you for that, Dr. Carroll. Definitely very insightful. Dr. Okoji, would you like to expound on if the mentors that you've encountered during your process to dermatology and where you are right now?
Absolutely. So I've had mentors at every stage of medical school and into residency now. So when I entered medical school, I had no idea what I was interested in. I was kind of interested in everything. And during my second year of medical school, I actually attended a networking reception where, physicians from a variety of specialties interacted with medical students. And I was fortunate enough to link up with a dermatologist in Philadelphia. She asked me what I was interested in. I said, I have everything. And so she told me to shadow her literally the next day. And so the next day I went to her practice, and that's kind of where I fell in love with dermatology. Unfortunately, I when I started medical school, my school had a dermatology residency, but by my second year, it had ended. And so I didn't have a home program. And I was lucky enough that, she had kind of taken me under her wing and had become such a great mentor and sponsor for me, and guided me through, third year, fourth year into residency applications, also connected me with other mentors who I still connect with to this day. And they've really helped me in kind of defining what I want my career to look like, connecting me with the right folks to, who are doing the things that I am interested in. And, they become like friends to me. We've kind of moved from that mentor-mentee to, friendship, where we're constantly, texting each other, keeping in contact, seeing how their kids are doing. And so, I would say without those mentors, I definitely wouldn't be where I am today. I don't think would have been able to, match into dermatology and match into a program that I really wanted to be at. And so I think it's critical to find mentors who not only, who are able to sponsor you, but also push you to achieve, all the goals that you see for yourself.
Absolutely. Thank you for sharing that, Dr. Okoji. Then, Dr. Ward, if you could just share, if you wouldn't mind sharing some of your experiences with mentors you've encountered during your ascent to where you are right now.
Okay. I've been fortunate enough to have a lot of great mentors, not necessarily in the field of plastic surgery. I'll say when I was a medical student, my third year general surgery rotation, my actual attending preceptor for general surgery, I remember telling him, I wanted to go into plastics, but I was like, I won't say much about it because sometimes people don't want you to say you're going into plastic surgery just because there's the general surgery route to get there as well. But he was one of my biggest mentors. He actually ended up stopped practicing general surgery, went to do fellowship, and is now a plastic surgeon now. So he still continues to encourage me. My other biggest mentor, transplant surgeon, Dr. Velma Scandabari, actually the first Black female transplant surgeon in the United States. She's been my biggest mentor since I was a medical student, from when I was doing away rotations all across the country. I'd stayed with her when I was rotating at Christianacare in Delaware for a general surgery rotation. When I was in Philadelphia, because I did my general surgery intern year at PCOM Philly, and I didn't match that time, she drove up from Delaware and offered me words of encouragement. So she's been one of the biggest mentors in my life, who's not plastic surgery, but always pushing me, always, making sure I continue to strive. And then, there's just other people, even just from networking, going to the Society of Black Academic Surgeons conference back in 2019 and being at the women's reception and just saying, I'm interested in plastic surgery, I'm having issues. And then, one of the women there was like, oh, I'm a program director in plastic surgery, and having that mentorship that still develops. So I've been really fortunate to have plenty of mentors over the years.
Thank you for sharing that, Dr. Warren. All right. So before I continue asking our panelists questions, I just want to definitely reiterate to everyone watching, please feel free to drop comments in the chat, and or questions, and definitely, we'll definitely read them to our panelists so they can answer accordingly. I see a question. So this will be for any of our panelists to take. Outside of diversity efforts, where do they see their future specialty heading? What are some cool, innovative things that are happening in their field of specialty? So I guess we can start with dermatology first.
All right, so I'll speak as the chair of the surgical section of the Association of Professors of Dermatology. Our goal of supporting inclusion and diversity within the specialty of dermatology is a very important priority for our organization, and it's the American Academy of Dermatology has also been pushing very strongly to include diversity and inclusion. And cool, innovative things. I think that we have probably a 1,000 different action points that we need to do. So visiting high schools, we're here in Cleveland, we have a curriculum for one of the local high schools to introduce them to dermatology and to get people excited about being in the field of medicine, allowing them to see that a white coat is not something that is impossible for them to obtain, try to normalize things and show them that there is a path. Medical students, very glad to be involved with the NMA to mentor medical students, help them find their path. And residency, we're very much at the residency and fellowship level, trying to identify those who are representing some of the demographics that are not well represented within our specialty. We're a little bit embarrassed to have orthopedic surgery as the only other specialty that has a lower representation than us. So it's a priority. Plastics, you're doing better than derm. Good job. But we're trying to do better. And it's something that takes multiple interventions, multiple reaching out to identify our leaders of tomorrow.
Thank you for that response, Dr. Carroll. All right, and as far as for plastic surgery, does anyone want to take that question?
Sure. I think innovation has traditionally been a part of plastic surgery. If you go back to the first, kidney transplant, Dr. Murray was actually a plastic surgeon. And I'm proud that our field kind of continues to be involved with innovation. In the future, a lot of what I see involves using technologies that may have other applications to help improve the field of plastic surgery. So I'll speak to one that I'm personally pursuing, and that's involving the Vinci surgical robot. Now, there's a lot of plastic surgeons across the country that are using the Vinci, but I would say it's not currently mainstream plastic surgery, but I expect that it probably will be in the next 5 to 10 years. Also with plastic surgery, and I would say dermatology and a lot of other fields, we're seeing our specialties pay a little bit more attention to instructing students and residents on the business of medicine in our specialties, because that's very important. And that's an aspect of medical education that is probably not lacking everywhere, but overall a little bit lacking. So as a specialty, I think we're starting to pay a little bit more attention to equipping trainees to be business people when they graduate. Lastly, I wanted to mention the plastic surgery common application. So I think that's innovative in and of itself. And the idea behind the common application is to have a mechanism that's more accessible, affordable, and that lends to more holistic rating of applicants. So we're trying to focus on impact. It gives you an opportunity to explain impact that you've had, most significant publications, and it's not all about numbers. So I think that's a very innovative thing.
Nice, nice. Thank you for sharing that, Dr. Davis.
Appreciating that Dr. Davis answered the question. Reading it again, it's outside of diversity efforts. So,
Okay. Yeah, no, for sure. Thank you for that eloquent response, Dr. Davis. So for our next question from the chat.
I just want to add,
Absolutely.
I think everything is cool in plastic surgery. I mean, I'm still in residency, so it's all fascinating to me. But yeah, everything's cool. Everything's innovative. I love it.
Okay. Dr. Okoji, do you have anything to add or just?
No, so I mean, I think Dr. Davis and Dr. Carroll actually said some great things. I also think in dermatology, Dr. Carroll, correct me if I'm wrong, but I think there's a push towards artificial intelligence in dermatology. There's been a lot of discussions around how we can integrate artificial intelligence into dermatology, whether it's using apps or computers to identify different skin conditions and kind of categorize it through that way. And so, I'm really excited to see, what the future holds for dermatology as it relates to artificial intelligence.
Yeah, there's a fear with some dermatologists that the AI visual recognition is going to make us irrelevant, but I'm quite confident that that's not going to happen. And innovation in machine learning visual recognition is only going to make us stronger.
Absolutely, absolutely. Okay. All right. So our next question we have here is this would be more geared toward plastic surgery. Do you recommend a research year to match into plastic surgery?
So I could start with that one. I would say not necessarily. It really depends on where you're coming from and what your CV looks like. And we're asking what a well-rounded applicant is. We want for you to have leadership. We want for you to have community service. We want for you to be academically strong and research credibility. Well, what does it mean to have research credibility? I think that may vary somewhat depending on the program, but it is important to have research experience, maybe some poster or oral presentations, and I would say at least a handful of publications. Now, if you're in a situation where you've identified interest in a competitive specialty late, you don't have any publications, a research year may be a good means for you to enhance your CV in that regard, but that's really a very individualized question.
And then from my standpoint, I also agree. I did not have a research year. Part of that decision to get my license and start practicing was, I wanted to make money. I have a kid. So the research year didn't come into play. But I also entered into medical school, having been a research associate 4 years prior as a career. So I came into medical school with publications, posters, all those things that medical students strive to work for. So I didn't necessarily have to put in as much effort for that because I already had all of that. And then, I did make sure to have a surgery publication, but prior to starting residency. But you don't necessarily need the research year. And I always say, if you're one of the ones who don't match into something, because getting your license opens up so many doors while you're trying to apply.
Exactly.
And the research here for dermatology is a topic that we get asked very frequently. And I think a third of applicants have taken a research year. But it really is something that does not fit everyone. And the advice that I individually give to my students is to think about their 10-year goals. And if their 10-year goal is to be in research, then yeah, taking advantage of every opportunity to do more research is important. But if 10 years from now, you're going to be more engaged with your community and service is going to be your brand, your mission, then in school, be doing things that are service related, that really build out your strengths and the things that you want to be doing. In that, you'll probably make a publication or two that gives you something to talk about. But you want the things that you do to be valuable for you, that define what you want to be 10 years from now. And you shouldn't do things just for the purpose of trying to check a box to say that you did the things to get in. And when we interview people, we're looking for that 10-year passion. We're looking for a story that makes sense. And that, I was working in an OBGYN department saving babies because that's what our community needed, that's a strong sell for dermatology. There's no skin in that work, but it's something that we resonate with as a mission that people wanted to do, and you don't need a year off to do that.
Hey, Dr. Okoji, would you like to add anything?
No, I think echoing what Dr. Carroll said, I did not do a research year, but I did do research during, second, third, and fourth year of medical school. So I was fortunate enough to have publications. I did think about doing a research year just because, it's normally you think that that's what you're supposed to do. Initially going in with my interest in dermatology, I had heard that a research year is required. And so I think a lot of applicants think that it's something that's required for a specialty like dermatology. But after speaking with mentors, speaking with program directors, they echoed a lot of the same things that Dr. Carroll said. It's really based on what your interests are and where you see yourself in the future.
Thank you. Thank you for sharing. Thank you all for sharing. Okay, so for our next question, we have from Ariel Vincent. What are some of the steps that I should take in my M2 year if my program does not have a home program for plastics? Do you recommend taking a research year? Well, more so of just, I guess we already answered the latter part, but it was just say what steps should she focus on regarding the fact that our home program doesn't have a plastics surgery program?
I could just say from my perspective, I'm a DO, so the majority of osteopathic schools do not have a home plastics program because the plastic surgery programs that are DO related are fellowships. So from my perspective, I was reaching out to plastic surgeons in the area, asking them if I can come with them or even if they'd be open to be a preceptor. So I found a way to network around that. And then I don't know how it works with COVID, but for fourth year, take advantage of those away rotations where you can actually go to institutions and rotate with those plastic surgery residents.
Yes, I would agree with Dr. Ward says. What you really need, and it was hinted at earlier, is you need to have access to mentors and sponsors within your specialty. And if you don't have a home program, that puts a barrier in place for you. But what you need to do is to access some in your city, in your region. There's resources online, there's virtual research conferences. Get involved with research. That's a great opportunity. And you don't necessarily have to take a research year, but if you've identified that as a weak area in your application, it may make sense for some people. I do some virtual mentoring. There was a student that didn't have a home program. She realized that she didn't have many publications, did a research year, gained several mentors and sponsors, as well as 10 publications. And that made a tremendous difference in the strength of her application. So for some people, it does make sense. But really, if you don't have a home program, that doesn't mean you have to do one. But sometimes that may be something that will make you a lot more competitive.
Thank you, Dr. Ward, and Dr. Davis, for sharing. As far as on behalf of dermatology, for Dr. Carroll and Dr. Okoji, could you speak to maybe some students that don't necessarily have access to dermatology department at their institutions, like what they should do?
So I can jump in. So because this was my story, when I became interested in dermatology, my institution had just lost the dermatology department, so I did not have a home institution. Fortunately, I was in a city in Philadelphia that had many medical schools that had dermatology departments. And so I relied heavily upon those departments for mentorship and support with research. So, I had mentors at the University of Pennsylvania. I had mentors at Temple University. I had mentors at Jefferson and Cooper in New Jersey. And so I really leaned into that and, basically making those programs my home program. And I was fortunate enough to be able to work with several dermatologists at those institutions, get some do research with them, get publications, and also build name recognition, in that they were able to connect me with programs in areas or cities that I was interested in matching in. And so, for someone who doesn't have a home program, I would definitely say, look at your surroundings. If there are other programs in your city or in your state, reach out to those program heads, reach out to those faculty, and start building those connections, because they're honestly very valuable.
Okay, and great advice. And for those that don't have Penn next door, because Penn is one of the strongest derm programs in the country, deep well of mentors there. So if you need to be reaching out by email, so I get about 400 emails a day, and a couple a week are people who are saying, I'm looking for a research project, can you add me onto a research project? That generic email sent to everyone doesn't resonate with me. You have tools with PubMed to find, with the internet, to find out what people are doing, what their passions are. And if someone writes to me that they saw this thing that I did, and they explained to me why that thing resonates with their 10-year vision and their mission, and they propose something that we're going to do together, I will always write back to that. But for those that just say, can you put me on a project? I just write back what I just said. Hey, go read about me or anyone in our department. And if you need me to introduce you to someone who's aligned with your vision and your goals, I'm happy to make the match. But I want to see some skin in the game. I want to see some investment, that they actually have looked into some of the literature and understood a little bit of what we do before they reach out. It makes sense. So you don't come to me for asking about how to treat psoriasis, because I do advanced aggressive cutaneous oncology, and I do melanomas and squamous cell. And if you ask me about a rash, I'm really not that interested in it. So it's best to align yourself with the things that the mentors that best fit your vision.
So if I could add one thing, it is important to have mentors in your specialty, but also be resourceful with what's around you. Mm-hmm. So Dr. Carroll just mentioned melanoma. I mean, you could be a part of a melanoma related project with a general surgeon, with a surgical oncologist, with an ENT, and that could be relevant to applying to dermatology or plastic surgery. Even if the subject matter of your research is not directly related, it's still important to be involved in research. And I think we all understand that not everyone has access to the same research opportunities. That's separate than gaining mentors, which is equally, if not more, as important, but a separate thing.
Excellent point.
Yeah, definitely excellent point. All right, thank you for sharing that. Thank you for sharing that, all doctors. Our next question is for Dr. Ward. How many times did you apply to plastic surgery, and how did you reinvent your ERAS? Did anyone also reapply more than once? And if not, did you consider a backup plan if you did not match into your field?
So ERAS cycle apply. There were 2 cycles where I applied to plastic surgery, but what people don't realize is there are actually APDS, the Association of Program Directors of Surgery, has general surgery positions, and then ACAPS has plastic surgery positions. So for years, every single day I would stalk those websites, and if an opening came up, I had a 45-page application that had my picture, my CV, my board scores, transcripts, everything, and I would submit that right away. So to answer how many times I applied, a lot. Backup plan was, when I originally graduated from medical school, there was still the merger between DO and MD. So the plan originally starting medical school was to do a general surgery residency followed by a plastic surgery fellowship, just because plastic surgery is very hard. And as a DO, there's still some institutions still have that view of DOs. So that was the backup plan. And then when I applied the final and third time, I just went all in. I applied to almost every single general surgery program and every single plastics program. I think I applied to 366 programs that final cycle. So to answer the question, I applied a lot.
Thank you for sharing that, Dr. Ward. So I hope that answers the question. So for our next question, um, from Opal Hopes, we have any advice navigating feelings of self doubt or like you're betraying your roots by pursuing such advanced academic and or business minded specialties? I guess we can start with dermatology.
Go ahead, Dr. Carroll.
I would just point out that self-doubt is universal. It's all of us, me still have feelings of imposter syndrome, of where we're invited to do things for our specialty, we're invited to do things in the line of work that we do, and we're not sure why the guy next to us or the girl next to us wasn't picked first. And I still think that my matching into derm was a mistake, that someone put the name in wrong, and it was maybe Brianna Carroll that was supposed to be picked, and they got me instead. So imposter syndrome. I think the second part of betraying roots is something that we hear with some medical students who are considering dermatology and saying that their community thinks that they should be doing something that isn't frivolous, and dermatology is sometimes viewed as frivolous. And for them, we just reinforce the Stevens-Johnson syndrome and squamous cell and melanoma deaths each year. There's a lot of morbidity and things that are ugly about dermatology that if you educate your community about that, they'll appreciate your service towards this specialty.
Yeah, and I can just piggyback off that. Self-doubt is definitely real. I was not going to, although I was interested in dermatology, I just didn't think I was good enough. I didn't think that I would match. And up until maybe beginning of almost mid fourth year, I was planning on applying to something else other than dermatology, although dermatology was my passion. But I put those doubts aside. I relied on the advice that my mentors had given me. Talked to my parents, and they just pushed me. So basically, surrounding myself with people who thought the world of me, and so I was able to put that self-doubt to the side. And as far as betraying the roots, I've definitely thought about this initially, but I think a lot of people don't realize just how impactful dermatology is, and I think that's something that a lot of the organizations of dermatology are working towards changing the view of. I honestly see dermatology as a form of primary care, in that patients come to you. A lot of patients will not go to see their primary care because they're having chest pain or leg pain, but they will go to see someone if there's a rash on their face or something that's really bothering them, with their nails or their hair. And once you have them in the office, you're able to look at them and kind of understand what's really going on. There's so many cutaneous manifestations of underlying systemic diseases that dermatologists see. And so, if you see a patient that has a certain rash that's associated with a malignancy, you're basically, getting them into the door and being seen. And from there, you can then, refer them to go see a PCP or to go see another specialist who can truly treat them for what they're dealing with. And so, I think there's so much that dermatology offers. There are lots of disorders that disproportionately impact individuals with skin of color, and so there's so much research that still needs to be done in many conditions. And I think that the impact that you can make is tremendous.
Thank you, Dr. Okoji and Dr. Carroll. As far as for on plastic surgery's behalf, Dr. Davis and Dr. Ward, if you'd like to add anything.
Dr. Ward, you can go first if you want.
Okay, thanks. So like others have said, the feelings of self-doubt never go away. There's always going to be imposter syndrome. And then from my standpoint, getting rejection after rejection after rejection, I mean, of course you start to doubt yourself, but then you have to realize, why do I have this vision, this dream, this goal? Like, it won't go away. I mean, I was working, I was making money, life was good, but I was just like, this is my dream, this is my passion. So you just got to keep pushing for what you want. And then the betraying your roots, I think plastic surgery gets a bad reputation because people don't understand what we do. Especially living here in Miami, people think it's just abdominoplasties and breast augmentations all day, every day. They don't see things like craniofacial, like fixing cleft palates. They don't see breast reconstruction from women with breast cancer. They don't see, even the trauma like that we do with lacerations and all the repairs. So it's not betraying the roots. We all have a purpose to do things. It's just educating the public for them to understand what we do with our specialties.
Yeah, I agree with all of that. Definitely have had feelings of self-doubt. And as for the idea of betrayal, I feel like what area can you better help from than within a specialty or an organization? And throughout every specialty in medicine, we need diversity. We need physicians from all walks of life, and that makes our patients feel more comfortable. That also helps for all of our specialties to innovate and to be better. So, as a plastic surgeon, I can mentor someone to be a plastic surgeon. And if I wasn't, I couldn't. Same for patients. You never know when you may be an inspiration to someone. So I don't think it's a betrayal. I think if anything, it can help open opportunities for other people.
All right. Yeah. Thank you for that, Dr. Davis and Dr. Ward. Definitely deal with self-doubt every day. All right. So for our next question from Laureen, for the plastic surgeons, with a lot of programs becoming integrated, do you recommend doing the general surgery to plastics route or just applying straight to plastics?
So I can start with this one. So I actually did general surgery, and that was a different time. It was just 12 years ago, but there's more than double the number of integrated plastic surgery programs and spots in the country now. And the truth is I'm glad I did general surgery, but if you want to match into plastic surgery, that's what your passion is, then I think it's worth going for the integrated pathway, because 5, 6, 7 years from now, we don't know how many of the plastic surgery independent pathway or more fellowship pathway spots will be left.
And just to bounce off what Dr. Davis said, I'm in an integrated program, but like I said, as a DO, generally it's been general surgery to plastics, and still there's this sense of having to prove yourself as a DO sometimes. So a lot of people still continue to do that. I recommend you do whatever it takes to get to where you want to go. So if that means do general surgery first, if that's what you match into, you make it work, you build the connections, and then you try to do a plastics fellowship. That's just my perspective.
Thank you, Dr. Davis and Dr. Ward, for that. All right. So our next question from Shannon, she states, I know none of you are international medical graduates, but what would your advice be to an international medical graduate student in regards to standing out and matching into one of these specialties, especially now that step one is pass fail?
I'll just say that it's hard. So I had a research fellow who was a foreign graduate, and placing her was very hard. So she was stellar by all academic criteria, but there's some issues of visas, and for her as a non-U.S. citizen, visa issues that complicated it, and many programs don't want to take on that extra work for doing visa work if they've got candidates who don't have that extra challenge hurdle. So the question of what can you do? I need to do something positive to reinforce. The success of my research fellow was her strong relationship with the program that we were in, and her ability to establish a record of excellence and win the trust of an entire department. It's putting all of your eggs into one basket, and it's not an easy road.
Thank you for that, Dr. Carroll. All right, and yep, Dr. Ward. Yep.
Oh, I'm not a program director, obviously, but I am fortunate enough to be in a plastic surgery residency program that is more IMG heavy. My class was the first class, and out of the interns, I believe 4 were IMGs, and then this year we matched 2 IMGs out of the 3. So I would say things I've noticed are networking, presenting. I know a lot of them presented research at conferences. With step 1 being pass-fail, I tell anyone, IMG or not, focus on step 2, because a lot of these programs are still filtering by numbers. So take step 2, focus on that. But don't let the IMG status keep you from applying. Just being in a program where a lot of my co-residents are IMGs. My program director was IMG, so they do exist.
All right. Well, thank you for that. And then with our last question for the night from Cheech Mulunga, with mentorship being a key factor in your respective journeys, how did you continue to cultivate that relationship with your mentors? We can start with Dr. Carroll. You want to speak to that?
All right. So I have a lot of advice for maintaining that relationship. So one is to make sure that you're clear in your expectations of what you're going to be doing in the relationship, what you're going to be asking of them, and then delivering on anything that you said that you would do. And then just sort of avoiding what I call the submarine mentee, which is the one that disappears for a period and then comes up in a froth of hysteria of something that I don't see them for 6 months, and they come and they tell me that the world's coming to an end, and then they disappear for another 6 months. Better to just keep an even keel of like a regular monthly communication at least. Check in on, things are going well. Or if you need them, hey, can we meet in the next 2 weeks? I have some issues that I want to talk about. Maintaining that relationship is important as a regular communication. There was a question in the chat about, can you have too many? All of us have different degrees of social batteries. I know some people who can maintain relationships with 1,000 people. If you've got a smaller social battery, just make sure you've got enough battery to maintain that relationship and keep the communications open and not submarine and then reappear 6 months later with an emergency.
All right. So with that, we think, with that being our last question, a final question that I would like to leave everyone with, for all of our panelists to answer, would be, what words of wisdom can you leave with our audience tonight? As just a few words of wisdom. And we can start with Dr. Ward first, since Dr. Carey just finished, then we'll go back in reverse.
Words of wisdom. What's meant to be will be eventually. So, if you go through it, you have the doubt, you don't match, but it's in your heart. Keep pushing, keep taking the steps, and eventually everything falls into place how it's meant to be at the perfect time.
Thank you for that, Dr. Ward. Dr. Davis, do you have any words of wisdom?
I would say follow your passion, and we're looking at applicants. It's clear, if you enjoy, women in surgery and diversity and, serving underserved populations in your research, publications, and leadership opportunities dictate that, then we kind of know what you're about. So follow your passion. You'll be happy and you'll be productive. And then just to highlight something Dr. Carroll has said multiple times, relationships are very, very important.
Thank you, Dr. Davis. All right, Dr. Okoji, do you have words of wisdom you could leave everyone with?
I would say be your own biggest advocate. I think it's important to present yourself, wherever you're going, and always advocate for yourself. It's you never want to expect someone else to support you or to network, connect you with certain people. You always want to be the person who's kind of guiding that. And so wherever you're going, just remember how great you are. Remember all the hard work that you put in to get to where you are now, and allow that to motivate you and guide you through your path and your journey to where you can be.
Thank you, Dr. Okoji. And last but not least, Dr. Carroll, do you have
And the pressure of having seen all of these in like 5-word summaries. So I'd say live your 10-year self, and then any hiccups on the road you won't notice. So if you've got a vision of what you want to be 10 years from now and you're living that today, match is a small part of that. And if you're living that vision of yourself, you'll find the mentors that align with that vision, and the work that you love today will be the work that you love in 10 years from now, and match will happen.
Thank you, Dr. Carroll. Okay, so with that being said, I just want to thank you. I just want to extend a great thanks to our amazing panelists. We appreciate your support of the SNMA and our membership. Just want to thank you. Can express how thankful we are that you took times out of your busy schedules to share some words of wisdom for us. So with that, just thanking you. And lastly, I encourage you all to follow us on Instagram at SNMA_official, on Twitter at SNMA, and like us on Facebook. But most importantly, if you are not a national member, please visit snma.org to sign up and get connected. I just want to thank you all for tuning in, and I look forward to seeing you all at our other upcoming Sowing Seed webinars. And just